I'm David Gray. I'm the Director of Government Relations and Connected Health Policy for HIMSS. Thank you so much for inviting me to give an update on a very important bill, the Black Maternal Health Momnibus Act of 2021, known simply as the Momnibus. So the Momnibus package seeks to augment and build on existing legislation to comprehensively address every dimension of the maternal health crisis in America. It's a great bill, and HIMSS is proud to endorse it along with the Match Coalition, which HIMSS is a co-chair and founding member. Before I dive into the Momnibus a little bit, I want to take a step back and provide some context and a little background around the Black Maternal Health Caucus, where the Momnibus bill originated from. The Black Maternal Health Caucus was co-founded in April 2019 by Representatives Alma Adams and Lauren Underwood, along with 51 other original founding members. The caucus is now up to well over 100 bipartisan members in the House, so it's definitely getting a lot of momentum, a lot of support. The goal of the Black Maternal Health Caucus is to elevate the Black maternal health crisis within Congress and advance policy solutions to improve maternal health outcomes and end disparities. We've all hopefully heard the facts before around the maternal health crisis in this country, but the U.S. has the highest maternal mortality rate in the developed world. Each year in the U.S., hundreds of women die due to pregnancy-related complications and thousands more suffer serious injury, with people of color and particularly Black and Indigenous women disproportionately affected. A report issued last month by the CDC shows that the problem has actually only gotten worse in recent years. In 2020, the U.S. maternal mortality rate was 28.3 deaths per 100,000 live births, with 861 known deaths due to maternal causes. Those are known deaths, which is up from 754 in 2019 and even less in 2018. Even more frustratingly, the CDC estimates that nearly 2 out of every 3 deaths are preventable, and nearly a quarter of these deaths occur at least 6 weeks postpartum, so after 42 days. So to take a comprehensive approach to tackle this critical issue, after nearly a year of work and meetings and stakeholder engagement, the Black Maternal Health Caucus introduced the first Black Maternal Health Momnibus Act in March of 2020 during the 116th Congress. It was led in the House by Representatives Alma Adams and Lauren Underwood, and ended the year with 73 total co-sponsors in the House. The Senate companion version was led by then Senator, now Vice President Kamala Harris, and ended up with 17 total co-sponsors. The first version of the Omnibus was a package of 9 bills that seek to make changes and investments in social determinants of health, community-based organizations, growing and diversifying the perinatal workforce, improving data collection and quality measures, supporting digital health tools such as telehealth, and innovating payment models to support improved maternal health outcomes. The bill was introduced right before the COVID-19 pandemic really upended our way of life, and while it still received great attention and support at the time, it didn't get a lot of traction with Congress as they were busy trying to deal with the newest public health emergency. Fast forward a little under a year to February 2021, the Black Maternal Health Momnibus Act of 2021 was introduced, led again in the House by Representatives Adams and Underwood, and in the Senate this time by Senator Cory Booker, who took over the mantle from Vice President Harris. The new version of the Momnibus included key feedback from stakeholders and incorporated lessons learned from COVID-19 on addressing increased risks to pregnant postpartum women during the pandemic. To date, the Momnibus package has 170 co-sponsors in the House and 29 in the Senate, which are huge increases over the previous version. The new package is composed of now 12 individual bills, up from 9, each also introduced as standalone legislation, allowing them to move separately from one another instead of being forced to move as one large package. So the Momnibus has attracted widespread support from a diverse group of stakeholders, including HIMSS, and has over 250 state and national organizations officially endorsing the legislation and advocating for its passage. So this slide is a list of the 12 bills or 12 standalone bills or sections that compose the Momnibus, as well as the lead members of Congress in the House and Senate that introduced them. For this, I really want to focus on two specific bills, the Tech to Save Moms Act and the Data to Save Moms Act, but I want to give a brief, very brief overview of each bill and sort of what it does. So the Social Determinants for Moms Act would make critical investments in social determinants of health that influence maternal health outcomes, like housing, transportation, nutrition, and childcare access. The Kira-Johnson Act would provide funding to community-based organizations that are working to improve maternal health outcomes and to promote equity by supporting bias and racism training and programs and research. It would also promote accountability in all maternal care settings. The Protecting Moms Who Serve Act would study the unique maternal health risks facing pregnant and postpartum veterans, with a particular focus on racial and ethnic disparities in maternal health outcomes, as well as support VA maternity care coordination at VA facilities. The Perinatal Workforce Act would help grow and diversify the perinatal workforce by establishing grant programs to increase the number of maternity care providers and non-clinical perinatal health workers who offer culturally congruent support to women throughout the pregnancies, labor, delivery, and throughout the postpartum period. The Moms Matter Act would invest in programs to support moms with maternal mental health conditions and substance use disorders, and grow and diversify the maternal, mental, and behavioral health care workforce. The Justice for Incarcerated Moms Act would seek to improve maternal health care and support for incarcerated moms by promoting exemplary care for pregnant and postpartum people who are incarcerated. The Impact to Save Moms Act would promote innovative payment models to incentivize high-quality maternity care and address issues around continuity of insurance coverage from pregnancy through labor, delivery, and up to 1 year postpartum. The Maternal Health Pandemic Response Act would invest in federal programs to address the unique risks around COVID-19 during and after pregnancy and advance respectful maternity care throughout future public health emergencies. The Protecting Moms and Babies Against Climate Change Act would seek to invest in community-based initiatives to reduce levels of and exposure to climate change-related risks, such as extreme heat, air pollution, and other environmental threats for mothers and babies. And the Maternal Vaccination Act would provide funding for programs to increase maternal vaccination rates to protect the health and safety of new moms and their babies. So that is a very high-level summary of 10 of the 12 provisions that make up the Momnibus package. So the first provision of the Momnibus, or standalone bill, here it's HR 937 in the House and S 893 in the Senate, that I really want to focus on is the Tech to Save Moms Act, which was introduced by Representative Eddie Bernice Johnson in the House and Senator Bob Menendez in the Senate. The bill would make investments at a high level, the bill would make investments to promote the integration and development of telehealth and other digital tools to reduce maternal mortality and severe maternal morbidity, as well as close racial and ethnic gaps in maternal health outcomes. The bill really has 4 key sections. First, it would direct the Center for Medicare and Medicaid Innovation, or CMMI, to consider payment models that improve the integration of telehealth services and maternal health care through the screening, monitoring, and treating of common pregnancy-related complications for Medicaid enrollees. The second section would establish a grant program to evaluate, develop, and expand the use of technology-enabled collaborative learning and capacity-building models for providers, students, and other healthcare professionals to treat pregnant and postpartum individuals. Funding from this grant program will be able to be used for training models that cover a range of topics such as implicit bias and racism, screening for and treating maternal mental health conditions and substance use disorders, and the use of remote patient monitoring tools for common complications in pregnancy and after delivery, as well as looking at the impact or effect of these models on maternal health care outcomes and addressing healthcare disparities. Funding from this can also be used on hardware and software that support distance learning, provider-to-provider distance learning, securing exchange of electronic health information, and supporting broadband access to ensure that these digital tools can be leveraged throughout the country. The third section of the Tech to Save Moms Act would establish another grant program to specifically address racial and ethnic disparities in maternal health outcomes by increasing access to digital tools, particularly for underserved communities and areas with high rates of adverse maternal health outcomes. This grant would evaluate the effectiveness of such programs on improving outcomes and make recommendations on things such as reimbursement rates for maternal telehealth services, the use of consumer digital tools such as mobile phones and wearables, and as well as identify barriers that prevent access to telehealth and digital tools for these populations. The last thing that the Tech to Save Moms Act would really do would be to direct the national academies to study the use of innovative technologies such as artificial intelligence and remote patient monitoring in maternal health care to prevent racial and ethnic biases from being built into these maternity care innovations. This is important because we've been hearing more and more stories around issues and troubles with racial bias in AI systems, as well as trouble with skin tone for certain medical devices such as pulse oximeters. So that is sort of a high-level overview of the Tech to Save Moms Act. And the other bill that I really want to discuss today is the Data to Save Moms Act. This bill, HR 925 in the House and S 347 in the Senate, was introduced by Congresswoman Sharice Davids and Senator Tina Smith. At a high level, this bill would support greater levels of community engagement in maternal mortality review committees, or MMRCs, and promote improvements in data collection processes, quality measures for maternity care, and maternal health research at minority-serving institutions. It would also seek to respond to the urgent maternal health crisis facing Native American populations. The Data to Save Moms Act really focuses on sort of 5 things. First, it would provide funding to promote greater representation and diversity on those maternal mortality review committees, particularly among Native Americans, and address certain barriers to participation of those committees, including compensation, access to transportation, as well as training. Next, the bill would task these maternal mortality review committees to consider issues such as using the most up-to-date indicators of severe maternal morbidity, whatever those latest indicators may be, since they're constantly changing. Review death caused by suicide, overdose, or other behavioral health conditions attributed to or aggravated by pregnancy or childbirth, since those are sometimes not considered a quote-unquote pregnancy-related death, as well as look at non-clinical factors that may contribute to adverse maternal health outcomes in various communities. Third, the Data to Save Moms Act would direct CMS and AHRQ, the Agency for Healthcare Research and Quality, to conduct a comprehensive review of existing maternal health data collection processes and quality measures and make recommendations on how they can be improved, updated, and modernized. Regarding data collection and dissemination practices, the review would be tasked with assessing the timeliness of data collection and amending death certificates based on new information so that if they are pregnancy-related deaths, they can be reflected in the death certificate for collection. Look at relevant data collected with EHR, such as race, ethnicity, and socioeconomic status, among others. Data collected and publicly reported from various healthcare settings. It would look at whether processes are in place to listen to the stories of pregnant and postpartum people and their family members that resulted in either an adverse health outcome or a death, as well as look at considerations of SDOH within data collection and dissemination. Regarding quality measures, the review would examine effective quality measures used in various care settings, the sufficiency of current measures that are being used to drive improved care and outcomes, so whether the measures actually are improving care and outcomes, maternal health quality measures that other countries are using effectively and how we can leverage them here in the United States, barriers on implementing new quality measures, and the frequency with which quality measures are reviewed and revised, among other considerations. The review would also provide recommendations around any necessary new authorities to enact those recommendations that they make, whether any additional funding or technical assistance would be needed to implement those recommendations, how to improve and standardize current quality measures specific to a focus on racial and ethnic disparities, as well as how we can improve coordination efforts by HHS and the various agencies. The fourth thing that this bill would do would be to commission a similarly comprehensive study on maternal mortality and severe maternal morbidity rates among Native American pregnant and postpartum people, and make recommendations on how those can be improved. And the last thing that the Data to Save Moms Act would do would be to invest in maternal health research at minority serving institutions such as HBCUs, tribal colleges and universities, Hispanic serving institutions, and Asian American and Pacific Islander serving institutions to study specific aspects of the maternal health crisis among groups from these various racial and ethnic minority groups. So, that's a high-level summary of the Momnibus and all of the provisions and all the ones that we've been specifically focusing on, the Tech to Save Moms Act and the Data to Save Moms Act. While the larger Momnibus package hasn't really gotten traction in either the House or the Senate, apart from securing almost 200 co-sponsors throughout both chambers, it's a huge number. It's a little under 40% of all members of Congress. A few of these standalone bills have seen some positive movement. In November 2021, the first Momnibus bill became law when President Biden signed the Protecting Moms Who Served Act. We also saw the House pass the Maternal Vaccination Act, which again supports increased maternal vaccination rates, although the Senate has yet to move on that bill. And lastly, the House Energy and Commerce Committee Health Subcommittee advanced the Data to Save Moms Act and is now awaiting action from the full committee. So that's sort of the activities to date in the 117th Congress. But additionally, the last thing I'll mention on that is, as part of the House-passed Build Back Better Act, that's the Democrat-only $1.75 trillion social spending package, every eligible provision from the Omnibus was included in that bill. This would have provided over $1 billion in funding to support Momnibus provisions, including everything that you see here, but including expanding access to maternal health equity digital tools. You get those telehealth, remote patient monitoring, and other digital health tools. Bias and racism training for healthcare providers, reviewing and addressing the impact of climate change-related maternal and infant health risks, as well as growing and diversifying the perinatal health workforce, including nurses, midwives, physicians, doulas, and maternal, mental, and behavioral health care professionals, among many other provisions. As I'm sure you all heard, unfortunately, negotiations broke down in the Senate late last year, and the fate of the Build Back Better Act, and especially the healthcare provision that it contained, which also included mandatory permanent Medicaid coverage for up to 1 year postpartum, is all incredibly uncertain at this point, with no real clear path forward. While this slide is really more specific to the Omnibus rather than the Momnibus, the last thing I did want to note is that after months and months of federal stopgap funding through continuing resolutions, the The recently passed FY22 spending bill, the Consolidated Appropriations Act 2022, contained a number of key maternal health care priorities. The Omnibus bill included nearly $1 billion in funding for maternal and child health programs to address maternal mortality and severe maternal morbidity, which was a 4% increase over funding levels for fiscal year 21. In addition to all these funding increases, it also included key provisions from the Maternal Health Quality Improvement Act and the Rural Maternal and Obstetric Modernization of Services Act, or the Rural Moms Act, both bills of which were endorsed by HIMSS and the Match Coalition. The Omnibus bill also contained several other maternal health provisions. It called on HRSA to identify, develop, and disseminate best practices to improve maternal health quality and outcomes, provide training for healthcare providers to improve prenatal labor, birthing, and postpartum care for racial and ethnic minority populations, including with respect to pre-existing perceptions and biases. It made improvements to rural and maternal obstetric care data, and it would also provide funding for the telehealth network and telehealth resource centers grant programs to include providers of prenatal, labor care, birthing, and postpartum care services to support increased telehealth adoption for maternal health care. So, while this isn't specifically a Momnibus victory, as you can probably tell, it does include many priorities that were identified in the Momnibus bill and championed by both the Momnibus co-sponsors as well as members of the Black Maternal Health Caucus. So the last thing that I want to leave you all with is a call to action. While the Momnibus bill and the standalone packages have tremendous support both on and off Capitol Hill, 250 outside groups have endorsed it, almost 40% of all members of Congress have co-sponsored it. It clearly hasn't been enough to get more than one standalone provision, the Protecting Moms Who Served Act, across the finish line. So to get these important provisions as well as the larger package signed into law, we really need to continue applying pressure on Congress. To support this bill, HIMSS and the Match Coalition launched a Legislative Action Center campaign in support of the Momnibus. The link is on the slide here. Really, with just a few clicks, you can call on your member of Congress to co-sponsor this bill, which it's really going to take even more than 200 if we're going to force leadership's hand to move this bill. You can also reach out to your elected officials and urge your members of Congress to call for hearings and markups for the Momnibus package, as well as standalone bills, which usually are necessary steps to get bills passed. They had hearings and markups, and then they're voted on. And then finally, we urge all of you to continue raising awareness of the Momnibus package as well as the maternal mortality crisis in this country through social media channels. If you're comfortable sharing your stories why addressing the maternal mortality crisis and ending racial and ethnic disparities in maternal health outcomes is important to you, and really just making sure that everyone knows that this is an issue that Congress needs to tackle immediately. HIMSS is proud to support the Black Maternal Health Momnibus Act, and we really hope everyone will consider doing the same. So that is it for me. Thank you again for having me provide an overview and an update on the Momnibus, and my contact information is there. Please don't hesitate to reach out if you have any questions on the bill or any of the provisions, or would like to learn more on ways you can support our advocacy or help push the Black Maternal Health Momnibus Act across the finish line, get it signed by the President. Thank you. That's it.